Our next presenter is Karen Meades. Karen is the founder and president of the Ottawa Services Network, otherwise known as OHSNI. OHSNI is initiated program in Nunavut and Ottawa to supply Canada's Inuit population with specialty health care. Today she will be presenting on the work that OHSNI does. So Karen.
Thank you so much for the opportunity to speak today. Thank you, Ashley. Yeah, I'm fine. I'll just press down. Yeah. I'd like to speak about what we fondly refer to as OHSNI, Ottawa Health Services Network, Inc., and we provide specialty healthcare services to the Inuit in Canada's far north. The north is vast, covering 190,000 square miles, a beautiful desert. Canadian Shield provides a rare rocky beauty to the landscape. I'm sure many of you have been north, but for those of you who haven't, I really encourage you to go. What we do, we ensure high quality care. We're ever mindful of our patients as the center of the care that we provide. And we intend to be a highly effective and efficient organization. We provide access to specialized health care, and we don't lose sight of that vision in delivering that specialized health care. In Ottawa, we coordinate appointments for folks. So what it looks like is the physician heads north. They hold a week-long clinic in the specialty that is their purview. Say it's cardiology, for example. They'll hold a week-long clinic in cardiology and see patients from Up Island. Typically see the patients in Iqaluit. Some of our docs do head Up Island when it makes sense and it's appropriate if there's enough patients to be seen. We'll do that to be more efficient, but generally speaking, they see the patients in Iqaluit, and if they require intervention, we then see the patients here in Ottawa. So there's flights that need to be coordinated, and on the ground, we coordinate the appointments for any of the hospitals. You saw one of the hospitals today with Julie for the TOH, but there are 13 or 14 facilities in Ottawa that patients can access. And we coordinate that through nurse case management, referral coordinators, and of course, interpreters who help the patients along with language. Our team is a director of operations, referral coordinators, interpreters, nurse case managers, and a research coordinator, a data coordinator. And we are a team of 26 people. And we're located here in Ottawa at the corner of St. Laurent and Smythe, in the Smythe Medical Building. Interpreters are Inuktitut to English, and we get to anybody who needs and a lot of people who want an interpreter. We do our best to run from appointment to appointment, and we even do our best to meet those needs when appointments run late, or patients are just being seen in an emergency setting. We do our very best, and we have 10 interpreters. So these are the specialist clinics. I'm really proud to say that we have 16 or 17 different types of specialty clinics and are seeing a broad range of health care and meeting a broad range of healthcare needs in the north. And this is what it looks like since we started, well, essentially started. We started in 1997 at about 600, and the statistics it's becoming such that the company's older than the slides will allow. So the information that I can fit on the slide that you can see starts at 2001 and takes us forward to today. But you can see that as our physicians become more familiar with the North, and as the North becomes more familiar with the physicians and what's being offered, that we're able to see more patients year over year. There is a sister organization to ours, Larga Baffin. It is a separate corporation, and it provides food and outpatient lodging to folks who find themselves staying in Ottawa, who don't need to stay in hospital, but nonetheless need to stay in Ottawa. And we work very closely with this organization. It's now a very large facility. Started out smaller than it is today, but it holds over 200 folks. So looking at where we are and what we've managed to accomplish, I'm very pleased to say that we have more physicians year on year who are associated with the program. We're upwards of 50 physicians. We are seeing more and more patients. We're doing it across a broader scope of what the patient needs are. And we continue to pursue innovative things like using telehealth more and more. Sometimes we use it for family visits. Sometimes we use it for healthcare needs. But we're being as innovative as we can to address issues and needs that we see that the folks in the North need. We think of ourselves as having an OHSNI spirit, and we think of ourselves as believing in the quality of healthcare in the North for the Inuit people, and we believe in providing access to what is wonderful Canadian healthcare to our residents in the far North. Thank you so much for the opportunity to speak today, and thank you, Ashley. I can't see where you are, but thank you.